Welcome to Curious Pharma. It is the third lecture of the part tablets. In the previous lecture, we have completed the dosage forms and its classifications: solid dosage forms, liquid dosage forms, semi-solid dosage forms. In the quick recap, we'll see what is unit dosage form, bulk dosage form, biphasic, monophasic, internal and external in semi-solid dosage forms. In the same lecture, we have completed the tablets, advantages and its disadvantages. In the second lecture, we have completed the what are the different types of tablets present, like oral tablets for ingestion, multiple compressed tablets, chewable tablets, tablets used in oral cavity, tablets administered by other routes, tablets used to prepare solutions, and the different types of coated tablets. In this particular lecture, we're going to cover we're going to cover oral tablets for ingestion and multiple compressed tablets. Here in the oral tablets for ingestion, we have a single type, that is compressed tablets or standard compressed tablets. And in multiple compressed tablets, we have two types, layer tablets and compression coated tablets. In this lecture, we'll going to a brief view of each of them. C. Tablets ingested orally. That means they are directly swallowed into the body cavity directly and through the mouth. Here, around 90% of the total tablets present in the market are orally ingested tablets because they are very easy to manufacture and very less steps are involved in the manufacture and cost effectiveness, and there are many advantages of making these tablets. So, around 90% of the tablets in the market are tablets ingested orally. Then, see, there are the major advantage of these standard compressor tablets are rapid disintegration and drug release. That means that the tablet is disintegrated very rapidly, and drug release is also very high at the particular location like stomach. Here, the disintegration time of these tablets are 15 minutes. It is a standard uncoated tablets disintegration time. Now we will see the disintegration types of different types of tablets. Here, see different tablets and their disintegration time. For uncoated tablets, it is 15 minutes. Coated tablets 60 minutes. Entry coated tablets 1 to 2 hours in the stomach and 2 to 4 hours in the intestine, which increases the absorption in the intestine. Those drugs which are acid labile can be manufactured by entry coated tablets. For effervescent tablets, it is less than 3 minutes. Hard gelatin capsules, at 15 minutes. And for the soft gelatin capsules, it is 30 minutes. Here, this is one important point. The moisture content in the hard gelatin capsules is 12 to 16%, and in soft gelatin capsules is 10 to 12%. It is very important point, which is very important for the GPAT and also NIPER. Here, these disintegration times are very important for NIPER examination because it is a very stressable area for the NIPER, and very direct question will come from this. Now come back to our main content. Here, some antacids or adsorbents are not that much soluble and having little solubility are manufactured in standard uncoated tablets because when they are ingested, since they have the rapid disintegration, they will be the antacids will be released directly into the GI fluids, which have its local action. So it is very suitable to form the antacids in the standard uncoated tablets form. Now, second one, multiple compressed tablets. This means in the name itself, we came to know that multiple compressed tablets are formed by using multiple compression or compressing multiple times. That means different see here there are two types of multiple compression tablets. By knowing these types, you will be able to understand what are the multiple compressed tablets. They are first one, two component systems. Two component systems, that means two layered. Three component systems, that means three layered. In the first one, two layered means tablet within the tablet, or three layered means tablet within a tablet within the tablet. Here I will be showing the images. See here, two-layer tablet means first a tablet is manufactured and it is placed inside the excipients or any other drug of another compression, and it is subjected to another compression. That means a tablet within a tablet. Tablet. That means two types of drugs can be administered at a time to release within a time gap, like paracetamol and aspirin. Both are given for the fever and can be helpful to release the two types of drugs at a time. In three-layer tablet, there will be three layers. That means first a small tablet is manufactured and there may be coated for an enteric coating, or then this tablet is compressed with another layer. That means this is second layer. Next, this tablet is placed in the another compression machine with the excipients and another coat is added. This is third layer. That means tablet within a tablet within a tablet, like that we can add as much layers as we want. Here we will see some disadvantages. Tablet compression speed is very low, since see here, except the final compression, remaining compressions are light compressions, because when the first a tablet is manufactured, it is placed inside another compression. The second compression and third compression, or whatever the number of compressions we are using to compress the multiple layers, should be very light to release the formulation and to penetrate the solvent to disintegrate. So except the final compression, remaining compressions, for final compression we use some strong compressing pressure, because it should consist of some friability and some good quality, and also it should withstand the transport. You remember all the advantages and disadvantages that are covered in the first lecture, so that you will be able to understand very clearly why these tablets are this tablet in the final compression we are using more pressure. Then the different types: layer tablets, compression tablets. Here, to prepare the layer tablets, since I have explained this, except the final compression, remaining compressions are very light compressions, we need more amount of time, and the product rate of production of the tablets is also very less, so it consumes lot of time. Provides initial doses. That means the prolonged usage and the preparation of this sorry these types of tablets can be prepared for intestinal drug delivery system also. Since we are using the different layers, if we add one layer, if you add any polymers, enteric coated polymers in one layer, then it will be used for the release of the drug in intestine. Then rapid disintegration. Since the first layer, or the foremost upper layer is is the outermost layer is highly disintegrable, so the inner contents are insoluble, hence the outer contents are very easily dissolvable tablets are prepared. Then adequate surface separation of the reactive ingredients. That means some APIs are very much reactive with the other excipient contents, so we'll mask this API with the another layer of excipients which are not reacted, and also some APIs are reacted with the buccal contents like saliva, and may able to disintegrate. So we'll cover the complete drug with a layer with a excipient, so that we can save the drug until it reaches the target site. Then compression coated tablets. That means it is coated inside with it consists of the inner core which is surrounded by a coat. Then even slow production rate than the layered tablet, since it includes many layers to manufacture. It takes more time than the layered tablets, and it is also used to achieve the controlled release dosage forms. Since we use the enteric coating or any some polymers, by using some polymers we can increase the time of release of the drug, so that you can able to prepare or to achieve the controlled release of the dosage form. Here there are some important points. Why should we prepare this type of dosage forms? The first point was to protect the drugs which are hygroscopic. Means hygroscopic means if a drug or any substance which is having the property to absorb the moisture present in the atmosphere is called as the hygroscopic property. Since I have said that H2O will make the drug more unstable and react with the other contents in the environment, this hygroscopic nature is not important and it should be avoided. So to mask this property, we will cover the whole drug inside a excipient or any other drug which is compatible with the external environment, so that it can mask the hygroscopic property of drug and can be released into the intestine or stomach. Then light sensitive drugs. Some drugs are directly sensitive to the light. If the UV light or sunlight falls on them, they may be degraded. So by providing the cover on the upper layer with the another type of excipient, we can able to achieve the stability of the drug which are sensitive towards the light. And some drugs are oxygen sensitive. That means when they are exposed to the atmospheric oxygen present in the environment, they may be able to degrade or can be converted into the different polymorphic forms. Then some drugs are acid level. Since I have said that the acid environment present in the stomach was 1 to 2 pH, which is not withstanded by some drugs and which should be released in the intestine, can be able to manufacture in the multiple compressed tablets forms, so that these tablets are uh, covered with the excipients, so that these outer layers will protect the drug from the acidic environment in the stomach and will be released or hydrolyzed. This outer layer is hydrolyzed inside the intestine. And to separate the incompatible drugs, if we have to release the two types of or three types of drugs at a time within a same dosage form, we are using this multiple compressor tablets. In these tablets, one layer is with the one type of ingredient, and the second layer is with the another type of ingredient. See here, two layer tablets. In these two layer tablets, in the first layer we are making with the paracetamol, and the inner layer is aspirin. Like the two different types of drugs which are incompatible and should be released at a time to avoid the number of frequent dosage forms. So in this type of preparations, we can deliver the drugs at a time. These are the examples: Avicel, diclofenac, potassium tablets, etc. Now this is the end of our lecture. In the further lecture, we'll be able to complete all the types of tablets, like sugar coated, film coated, repeat action tablets, delayed action and trick coated, and control tablets. These all topics will be covered in next lecture. So stay tuned. Thank you.